This pandemic has taken a devastating toll. It has forced millions of people out of work and students out of school. It has taken over 570,000 of our loved ones, and the loss, the stress, the loneliness, the trauma it has caused is doing immense harm to our mental health. And it's been especially hard on our essential workers, healthcare workers, and others on the front lines of this crisis. Around half of the adults in our country say the stress and worry of this pandemic has impacted their mental well-being. And when it comes to our youth, what I'm hearing from people in my state is incredibly alarming. Seattle Children's Hospital in Washington State is seeing 170 children with mental health emergencies a week compared to 50 before the pandemic. Sacred Heart Children's Hospital in Spokane saw admissions to its adolescent psychiatric unit and admissions to its pediatric floor for behavioral health issues both rise by around 70%. Mary Bridge Children's Hospital in Tacoma has seen mental health admissions increase by 2/3. Central Washington Hospital saw a similar increase in non-fatal suicide attempts for minors, and suicide rates in King County are up 30% for youth. And when it comes to the issue of substance use disorder, a record 87,000 people at least are estimated who have died from drug overdoses in our country over the last year. Overdose deaths in my state increased by 38% over the first half of 2020, with the biggest increases being among Black, Latino, and tribal communities. We must do more to address the tragic loss of life, as well as the terrifying effects we are learning COVID can have on mental health, with one study suggesting 1/3 of patients received a neurological or psychological diagnosis after their infection. And the challenge isn't just that more people need mental health care in the wake of this pandemic, it's that too many people can't get it. 1/3 of adults who say the pandemic has impacted their mental health also say there was a time this past year they did not get the mental health care they needed, most often because they couldn't afford it or they could not find a provider. And over half of high-risk children are not getting the mental health care they need, with the care furthest out of reach for Black children. Of course, while these are serious problems, they are not new ones. Even before this pandemic, we were fighting epidemics of suicide, mental health issues, drug overdoses, with a health workforce that was stretched far too thin. Almost 120 million Americans live in areas with a mental health care provider shortage, essentially meaning they don't even have one mental health care provider per 30,000 people. In Washington, our mental health care workforce is only able to meet 12% of our state's needs, and these challenges are especially hard on communities of color and rural communities, who often struggle the most to get mental health care. As we work to recover from this pandemic and rebuild our nation stronger and fairer, it is important we recognize mental health as a priority in our work. We have to address the unseen scars of trauma, depression, addiction, and other mental health issues. And the reality is that healing those scars will not be quick or easy. It will take years, and we need to act accordingly. When we passed the SUPPORT Act in 2018 to respond to the opioid crisis, I made clear it was only a first step and that I would be pushing for more action and more funding. This pandemic is a painful reminder that our work remains far from finished. We need to make significant investments in programs that already exist to help our communities fight mental health issues and substance use disorders. We need to make dedicated annual investments in our public health infrastructure and the local health departments on the front lines of these fights. And we need to make it easier for people to get the care they need by taking steps like President Biden announced yesterday to increase access to opioid use disorder treatment, and by looking at how to best use new tools like telehealth to reach more patients while ensuring quality and equity. Steps Congress took in the CARES Act to temporarily expand access to telehealth services have made it easier for patients to get mental health care quickly, discreetly, and conveniently. But we can't let the promise of telehealth be limited by a lack of access to broadband, especially in our rural communities and communities of color, and a lack of mental health care professionals to keep up with the demand for that care. We must also remember that telehealth is no replacement for making sure people have quality, affordable providers in their own communities, which is why we need to recruit, train, and retain enough mental health care professionals to actually meet our nation's needs and make sure they practice in underserved communities. So I hope we'll be able to work in a bipartisan way to tackle these challenges. Finally, any good doctor knows you can't just treat the symptom, you have to look at the root causes. We need to help people get the care they need for stress and anxiety and depression and more. But we also need to address the issues that have caused so much pain this past year, and that includes not only the pandemic, but systemic racism, gun violence, and an economy that works great for those at the top, but it doesn't work well for anybody else. I look forward to the work our committee can do on these issues and mental health and substance use disorders. We have a record of bipartisan work on some of this already. I'm going to continue to press for action. With that, I will recognize Ranking Member Burr for his opening remarks.
Well, thank you, Madam Chairman.